My parents never thought it would happen to their daughter. I never thought it would happen to me.
She lived to become a crusader against opiate addiction, but others not so fortunate. Tonight, shocking new figures from the state show overdose deaths here topped 1,000 last year. The problem is obviously growing very fast.
Tonight, John Keller gets us closer to the epidemic that is behind this death toll.
People are dying left and right. We're in trouble.
For Joanne Peterson, mother of an addict and anti-opioid crusader, and Rebecca Riley, a recovering addict just a few years out of Wayland High, this roundtable on opioid abuse with the governor and the U.S. Secretary of Health and Human Services was more than just another meeting, accompanied as it was by the release of chilling new figures on the carnage this drug abuse epidemic is causing.
I started off with prescription opiates, which is so many people's stories, and then, over time, heroin seemed like the better option, and in no time I was addicted to heroin.
People just don't realize how easily it can happen to somebody that they love.
A big part of the problem, they told the panel, a medical establishment way too eager to prescribe powerfully addictive painkillers, like the doctor Joanne saw after a minor car accident.
I had to say no maybe 4 or 5 times to the oxycodone. And I said, really, I don't need it. And he said, well, you should take it now, and get ahead of the pain.
Go to a hospital and tell them that my back hurt, and I knew that I could walk out with an opiate prescription, even though I didn't really need one.
What's the solution? More education and treatment, says Joanne.
That gap between detox and long-term treatment has got to be filled, because that person, when they leave, is in danger.
And the realization, says Rebecca, of how pervasive this threat is.
I had a great childhood. There was nothing wrong, and I still got addicted to heroin. It's a disease.
Now, last year, the state's prescription monitoring program found nearly 10,000 people were getting these pills at an alarmingly dangerous rate. And while they work on curbing reckless prescriptions, officials say you can help too, just by going to your medicine cabinet and getting rid of any unnecessary painkillers. And Lisa, maybe practicing saying no to your own doctor. How do you like that?
Well, and I thought both Rebecca and Joanne spelled it out so well. They're feeling it's almost an obligation that they take these drugs. And for many people, they don't know that they have that addictive personality, that addiction, until they take them.
A lot more questions need to be asked by providers, healthcare providers, by patients, by everyone about what you're being given, what the potential impact of it is. A lot of education needed. Those brave women speaking out really help.
Definitely. Our understanding grows when they talk. Thank you, John.